Dentists are more than just healthcare providers, they're artists as well. They must creatively envision the best possible outcome for each patient while delivering care. The unique fusion of science and art makes every day in the dental field both exciting and diverse. Welcome to Celebrate Michigan, the show produced on the campus of Madonna University. I'm Chris Benson, and joining us today is Dr. Timothy Kosinski. Dr. Kosinski is a fellow of the American Academy of Implant Dentistry, and he received his mastership in the Academy of General Dentistry. He's the chief editor for the AGD Journals and editor of Dentistry Today Implants. Dr. Kosinski has received many honors, including the Academy of Dentistry International's Humanitarian Award, in recognition of significant contributions to the enhancement of the quality of life and the human condition. What a cool award to win. So, Dr. Kosinski, we're so glad to have you back on the show.
Well, thanks for having me, Chris.
Yes.
Appreciate it.
Yes. So, a long list of accomplishments. I know you love what you do. What keeps you excited about the field of dentistry? What's going on today?
Well, that's a great way to start our program. Dentistry, I have a great team, number one. My team makes me look really good. And we do some very innovative things, and giving back to your community at this stage of my career is pretty important. But Chris, I can balance that with mentoring and giving back to my profession, because I'm on the road a lot, as you know. I travel and lecture, and I train many thousands of dentists around the country. And I always like to say, I was blessed with great mentors early in my career, and it's really, really awesome to be able to give back. I like to call it wisdom and experience. How's that?
Absolutely.
And share that with the younger generation, and show them what the innovations and what we can do to help improve the health, the dental health, but overall health of the public.
And I imagine many things have changed over the years that you've seen with dentistry, but it probably doesn't change that people need to find a dentist that they trust and they feel good with. You can feel very vulnerable, and it can be embarrassing, some of the dental conditions people have. What advice do you have for people on how do you find like the right dentist or the right practice?
Well, that can be a challenge, just like finding a good physician. It can be challenging. I think a word of mouth is really, really good. I think that, dentistry has changed a lot, as you said, because technology has advanced so much. So a lot of the things that took me 10 years to master, a lot of my young colleagues, we're kind of equals at this stage, because technology has improved, artificial intelligence and diagnosing and computer planning, and we see things in 3 dimension. We can actually virtually design things before we ever touch a patient.
Wow.
So I think it's important to find an office that is current, that's up to date with technology. But the big thing is, Chris, is communication. It's not me talking to you as the doctor, but finding out what your goals and ambitions are and see if we can meet those. So communication is really important.
Good to know. These are good tips.
Yeah.
I have to go back to what you said, AI. So we're all kind of learning about AI. How would a dentist use AI?
Well, there's so many things. We have CAD/CAM technology.
Okay.
We virtually design and mill almost all of our restorations today. It's all done by computer. We don't have technicians, rarely are painting porcelain anymore. Our diagnostic abilities, we have CBCT, CAT scan ability to actually see things, the whole head in 3 dimensions. We can place teeth, we can place our implants, which we're going to talk about later, before we ever touch the patient. So the technology has just, our diagnostic abilities, our fabrication, everything it's a great time to be a dentist, because it really is a lot of fun.
Well, and you talk a bit about the mentoring piece as you see dentists coming up in the profession, and what is making them go into it? Like, what is their what's their drive to go into dentistry? Because I imagine it's a tough field. You're on your feet all the time. You might be in situations that can be nerve-wracking because it's so important what you're doing. So what's driving this people to go into the field today?
I think dentistry, to be honest, is the greatest profession in the world. Okay, so the young people that do go to dental school, number one, they are very, very smart. Yeah. They're a lot smarter than I was in school. They're very, very intelligent. And so they're going in, we like to say we want to help people, but it's a great profession in that you can be a business owner, you have control. It's different than medicine, which is hospital-based or different hours. You can set your own hours. I had 3 kids, as you know, and a grandbaby now, baby Brooklyn, and it allowed me the opportunity to do all the things I wanted to do, to travel, to watch the kids play tennis or coach them. And there's a lot of flexibility in the profession and your financial reward for helping people. So it's a very rewarding profession. It's more than a job. When you make it a job, it's not so great, like you said. Yeah. But when you take it as a profession, it is very humbling and very rewarding.
Well, and I know one of the things that you have particular expertise in is implants. And you know, again, there's so many reasons why we can lose our teeth, right? You know, no matter what age. Yeah. So as you think about that, what is the latest that's going on with dental implants, and why are you so fascinated with it and involved with it?
Well, you know, replacing people's teeth is important, whether it be one tooth or several teeth or all your teeth, a denture, partial. Improving somebody's quality of life is dramatic. And when I started, it was experimental, so it was hard. Yeah. But technology has made it become routine, not routine for the patient, but routine for us because we do so many. We're coming close to 20,000 implants that I've placed in my career. That's a lot of implants, so you get pretty proficient at it. Yeah. So once we get over the apprehension of the patient of surgery and they realize, oh my gosh, that was it, it's almost easier than doing a filling today.
Wow.
It's really, the technology is really something.
Well, and I understand you brought a little video with you just so that people can understand what we're looking at. Sure. So let's take a look and tell us what is happening in this video.
Of course.
Might help take away some of that stigma, right?
So, you know, people that wear dentures can struggle. You know, the top plate, the roof of the mouth is covered, so taste buds are affected. And we can strategically design and place implants with little buttons. And the dentures are removable by the patient, so they're easy to clean, but they snap in. Oh, so we improve their chewing efficiency up to 60–70%. Oh, they're able to eat things that they were never able to do before. And yet this is a very cost-effective way for people to improve their health. You know, the mouth is a gateway to the rest of the body. And if you eat proper foods, your body is going to be healthy rather than taking medications. Wow. So this is really life-changing for people that are really struggling with their health.
Oh my gosh, so these wonderful technology advances, thanks for telling us all about it. Yep. We're gonna take a quick break, and when we get back, we'll hear more from Dr. Kosinski. Stay tuned.
Walking to school. I started thinking about lunch. Mom packed me turkey and cheese.
She's
I
smart.
really want cheese pizza.
Sometimes her mind wanders.
We should have a sleepover.
I remember saying, Laura?
I think I heard Mom say something.
The sign says don't walk.
Sometimes it's so overwhelming.
I really hope she doesn't have another bad day.
I really hope I don't have another bad day at school today.
When you can see learning and attention issues from their side, you can be on their side. Go to understood.org, a free online resource with support and tools to help your child thrive.
What to expect when you're expecting.
Like here?
A teenager.
Today, I'm going to show you how to teen-proof your home. First step, hide the car keys. Preferably somewhere they would never look. Challenges will come up. Be ready for them. Hi, honey.
Ready for the... Mom, you don't use mannequins in the mannequin challenge.
You don't have to know it all to be a perfect parent. Thousands of teens in foster care will love you just the same.
Sounds like you could use some Van Gogurt. It's fortified with arts-rich nutrients to improve your math and reading skills. Catch!
Van Gogurt, thanks. So what's the deal with your ear?
Always with the ear, huh?
Feed your kids the arts. For 10 simple ways to learn how, visit AmericansForTheArts.org.
Welcome home, man.
Welcome back to Celebrate Michigan. I'm Chris Benson, and we're here with Dr. Timothy Kosinski, a dentist whose practice is located in Bingham Farms. On the last segment, we talked a bit about, there's the health benefits of having, teeth that are functional, maybe some implants and some different things. But it goes beyond just our physical health. I know there's so many other benefits. Talk to us about that and the work that you do.
Chris, that's a really good point because, quality of life is pretty important. Life is really hard today. Ever since COVID, I think the world has changed. And people are very, very stressed, financially stressed, emotionally stressed. There's a lot of pressures put on us, and we do see it in the mouth. We see the negative applications of life in the mouth oftentimes. I've never in my entire career seen so many broken teeth. People coming in with broken teeth.
Yeah.
And there's also, an incredible need for good quality dentistry. And as we said, technology has improved, which brings the cost down to the masses, which is important. It doesn't have to be expensive because we're all on a budget. It doesn't matter what we have or don't have, we're all on a budget. So you have to find an office that's willing to work within your budget, but yet provide the highest quality of care.
And I am excited to share some success stories. We've got some visuals of some people that you've worked with. Tell us what we're about to see here.
Well, if we could run the video, yeah. So, people come in really struggling. They have decay, they're in pain, they're not able to eat a sandwich, things we take for granted.
Yeah.
Eating, soup every day is not great. Biting into a hamburger. I had a patient today I delivered, he goes, I just want a Wendy's double cheeseburger. He hasn't been able to do that in forever. So improving your health, your well-being, enjoying life. I think, again, with the changes in society today, we have to merge with society, with people. We have to communicate. We have to feel good about ourselves. There's nothing better than a smile. These young people here, they have great smiles and great teeth. You have a great smile and great teeth. It gives you confidence.
Yeah.
It improves your ability to find a better job, to advance yourself publicly. So it's important. What we do as dentists is really, really important. Like you said, it's art, it's sculpting, it's science, it's medicine.
So what have you been able to do to help people kind of make that more affordable and give them that boost where maybe they'll say, gosh, I can go apply for that job, or, I'm going to ask that guy or girl out,
Well, the people that you saw in the video there are part of a program called Renew Smiles. It's a program that was started by a friend of mine in Denver and a great group of people. And they really feel that it's important to be able to provide quality service to patients at a reasonable cost. So they have in-house financing, a good diagnostic, everything, going back to AI, everything is digitally designed. It's just amazing, amazing technology. And I was proud to be asked to be part of this program. And as we mentioned earlier, giving back to my community at this stage of my life is important. People are really struggling. The biggest comment I get from people come in, your office is so clean. That's just alarming to me, but heartwarming to me in that everybody should be treated equally. We're all human beings, and if I'm able to use my talents to provide a service through Renew Smiles and make it affordable for patients and the best technology in the world, it's amazing. And that's what's rewarding for me. That's what's important about being a dentist for me.
And I imagine that you worked with patients of all different kinds of ages, from all different walks of life. Anything stick out, as like a story? You can't share names or anything, but any ones that are just like, you're like, oh yeah, there was this one patient.
There's a lot. We treat a lot of patients. We do probably 100 implants a month.
Wow.
In the office, and so there are people that are in auto accidents. There's people that at a certain point of their life, they're doing something for themselves. Maybe they took care of their kids, maybe they took care of the ortho, or maybe they were financially strapped, and it comes a point in their life where they're starting to do things for themselves. People that can't function because their teeth are so decayed, and that disease is affecting their overall health. So they're taking medications, which is not good for your liver and kidney and all of those things. So, every day I think we see people that really need health. And I keep going back to quality, but quality health. So find the right person, the right dentist that cares, that communicates with you, explains the good and the bad, because there is, always things that can happen,
Sure.
And are willing to back up to warranty what they're able to provide you, so that you can function. You're investing something. It's not cheap, but it doesn't have to be overly expensive, and we can certainly work within people's budgets.
Well, and you talk about the health piece and investing. It sounds like it's an investment in your health, but then there's also that confidence piece that you mentioned, and just getting people to a place where they feel good about themselves, and sometimes it can be that does it for them.
But the one patient I saw today, we delivered top and bottom of these Snap-on dentures, and he was a man who's kind of, oh boy, what am I going to get? And he goes, I look like my brother. I have my brother's teeth. And I just smiled and I just said, success. Chris, success.
Yeah.
I changed somebody's life in that moment.
Yeah.
And that's a good feeling. That's a pretty good feeling.
And that feels so good, again. And that, just this whole piece that you just explained helps me understand why these awards have come that we mentioned at the beginning, because, again, investing in the community.
Just been doing it a long time, that's all.
Yeah, well, that's not a bad thing.
Yeah.
Well, we, again, are already at a break, but when we return, we will talk more with Dr. Kosinski, so stay tuned. We'll be right back.
Ready? Oh, come on, Randy. Animal shelter, here I come. And no, I'm not crazy or emotionally damaged. That's a stereotype. I just belong to a total loser. I'm a good dog. So if you want a pet, adopt. And if you see Randy, tell him he dropped his wallet.
Hi, I'm Peter. And there's nothing I love more than sharing vegetables with my friends.
Come on in. Help yourself to anything.
That's why we give our food the utmost respect it deserves. Did you know there are simple steps we can all take to help save food? You can cook it, store it, even share it. Just don't waste it. Because when it comes to food, better ate than never. To learn more, visit savethefood.com.
Maria, so how's work?
It was fourth period biology. Our students just weren't getting how easily viruses spread. So Miss Bella and I had them role play a zombie virus outbreak. By the time they had all learned the lesson, all the living were dead. Hey, how's your job going?
That big sales meeting I planned? Next year. I might get to go.
Cool.
So, are you going out tonight?
I can't. My parents say I have to be home right after work.
That's so gay.
Totally gay.
Ugh, that is so Emma and Julia. Why are you saying that's so Emma and Julia?
Well, you know, when something is dumb or stupid, you say that's so Emma and Julia.
Who says that?
Everyone.
Imagine if who you are were used as an insult. When you say that's so gay, do you realize what you say? Knock it off.
Welcome back to Celebrate Michigan. I'm Chris Benson. I'm here again with Dr. Timothy Kosinski. He's received the Academy of Dentistry's International Humanitarian Award in recognition of the significant contributions to the enhancement of the quality of life and the human condition. I just wanted to read that again, especially after our last segment, talking about the big changes that you can contribute to in people's lives. So thank you for doing that.
Well, thanks, Chris.
All right, so a topic that I've seen in the news a lot is fluoride. Yeah. And so, I grew up, as a kid, just assuming that there'd be fluoride, there's fluoride in the water, use fluoride toothpaste, you'd get fluoride on your teeth. Why are we all talking about fluoride now? What do you want us to know about it?
Well, it is very controversial, to be honest with you. And our organizations do have opinions. There's science coming out, just like amalgam and white fillings versus the silver fillings. So fluoride, started in Grand Rapids in 1945 when they
Really?
started putting fluoride in water, and it's national, and there's so many parts per million that theoretically have proven to be effective in reducing decay. Okay, especially in young people. And of course, we've seen a tremendous reduction in cavities in patients. So the controversy is, why are we putting fluoride in water for the general public when it's only beneficial to maybe a percentage of that public?
Okay.
And the issue there is, we can certainly put topical fluoride that you mentioned, but you're at a social economic level where you go to the dentist, it's routine. But there is a major part of our society that has been neglected in dentistry, and so they don't have access to care. And that bothers us as professionals. There are young children that don't have the wherewithal or the structure to be able to see a dentist regularly.
Sure.
And they end up getting decay, their baby teeth, and then their adult teeth, and they become dental cripples, as we mentioned before. And so it has to be a balance, Chris. I don't have all the answers, and I'm not going to provide. I think that water should be fluoridated, personally. Water should be fluoridated. I think bottled water should be fluoridated. I think you should use fluoride toothpaste. I think topical fluoride is important when you have that access to care, and I think those listening to us should be asking their hygienist or dentist about that, because there are accesses. I know in some areas here in Michigan we have I talked to some people earlier today, and it's not fluoridated, and they do have a higher caries, more cavities, highest carie rate in my office. And so those people, but they're coming to my office, so we're able to say, okay, let's get you fluoride tablets, let's give you whatever. So the controversy is maybe not so much that there's fluoride in the water for everybody, but maybe the amount. And maybe there has to be, going back to what we first started, communication. How about if we talk to each other and not set sides, but merge together and do what's best for the public good? That's what has to be researched.
And so you mentioned bottled water. I never even thought about it. So most bottled waters not fluorinated?
Correct. Yeah, as it says. But we're not concerned about the water in the bottles. We're concerned about the plastic bottles.
Yes.
So again, that's a whole other discussion. Get a different scientist for that.
Ooh, okay. Well, I appreciate you weighing in and just kind of helping talk through that, because there's a lot of information out there, and you try to figure out, okay, what's best for me.
And ask your dentist. I think talk to your dentist, and but again, a lot of people don't see the dentist.
Right.
And who are they going to talk to?
That's the concern.
Yeah.
Well, you talked earlier about your role mentoring, the next generation. So let's say there's someone out there who's thinking of going into dentistry. What would you tell them right now?
I'll tell you a quick story. I had my knee replaced 4 years ago. I'm gonna really short. Young lady that was the tech. She wanted to go to medical school, but didn't do great on her medical exams. I said, go to dentistry, go to dentistry. And I saw her 3 times a week. Go to dentistry, go to dentistry, go to dentistry. COVID hit. She came to work in my office. She became our reception. We got her in dental school. I'm waiting for her to join the practice. I'm very excited for her. So I'm a big proponent of dentistry as a profession, as we said earlier, because it truly is the best profession, and it gives you a quality of life second to none. So I think it's important. You have to take the prerequisites. I think you go to the dental school. We have 2 here in Michigan, University of Detroit Mercy and Ann Arbor, University of Michigan. Find out what those prerequisites are. But you don't have to be a science major to go to dental school necessarily. You have to do well on the exam, so you have to prepare yourself. But these young people are very smart. They're extremely bright. You have to learn to communicate. But that's a whole nother topic.
That's important.
But they're technically advanced to anything in my generation.
Oh, it's good to hear that, go into it. Don't be afraid of the challenge.
Go to your dentist. Work in the office. We'd be happy to have an extra body to see what it's all about. It's a really hard job, Chris. It's a great profession. Very, very hard job, as you were saying.
Oh,
It can be stressful. You're dealing with the public. You have a business. You have staff. You have all of those things that rely on any type of small business. But it is so rewarding.
And for those who might be out there, you mentioned trying to get services to people who might be in need. Where can they check to find information, to get information in their community, maybe?
So there's access in different counties here in Michigan. The dental schools obviously is a great place. It takes a while to be treated there, but if cost is effective. But there's a lot of dentists like me that give back to the community. The Renew Smile thing. I'm so proud that I'm able to give back to the community at a significantly reduced fee from what's out there right now. So we're out there. Just got to find us.
Where can people find you? Tell me your website.
Smilecreator.net. Smilecreator.net is our office website, and drkosinski.com is my education website.
Oh, okay.
If you want to see some of our articles, because we publish a lot. I've published over 260 articles. YouTube, we probably have 240 videos of the techniques we use. I just type my name in YouTube. So there's a lot of information out there that's really important, not only for the public, but for the profession.
Awesome. Thank you so much for what you do for everyone out there, and thanks for coming and letting us know a little bit about what's the latest in dentistry.
Thanks for having me. I appreciate it, guys.
Yes.
Good seeing you again.
You too. And thank you for watching. We're so glad you could be with us, and we always love that you tune in to Celebrate Michigan, where we celebrate all the good things happening in the Mitten State. See you next time.